Welcome back. I'm Dr. Joe Sirven, and this is What's Health Got to Do with It. Health savings accounts. Now, they've been in the news quite a bit lately, but many people still don't fully understand how they work or why they matter. Joining us today is David Silverstein. He is CEO of Amaze Health and a national expert in healthcare policy and innovation. He's also a former U.S. Navy nuclear submarine officer and brings that experience navigating high-stakes environments to the challenge of navigating healthcare today. Mr. Silverstein, welcome to our program.
Great to be here. Thank you for having me.
You betcha. We are excited to talk to you about this. I'm going to go right into it. What is a health savings account? Who is it for?
Yeah, that's a great question. You know, the concept of the health savings account was created decades ago as part of the effort to drive greater consumerism in healthcare, right? The thinking is if you put money aside and then you have to spend effectively your own money on healthcare, you're going to make better decisions. Nice idea, right?
Yeah, it sounds great so far.
But as we've learned for the last couple of decades, and in particular since the Affordable Care Act became law, we can't become good consumers of healthcare simply because we've got so-called skin in the game if we don't have the information that we need to be good consumers. So the concept of the health savings account was well-intentioned and a good idea, but we didn't fix the rest of the system that provides people with the information that they need to make good decisions. So we're stuck in the same system we had before the introduction of health savings accounts, which is, in general, we're not seeing the price of what we're paying before undertaking the transaction. So they haven't really driven the behavior that we're looking for. Instead, today, HSAs have become something different for many people.
Okay.
And that is an alternative retirement account.
Huh.
I get a very uneasy feeling every time I'm at an employer sitting through an open enrollment session for employees where they're selecting their benefits, and somebody from a bank stands up to talk to people about their health savings accounts and starts explaining to them how to use their HSA debit cards. And the reason that I cringe when I see that is that nobody should ever really be using their HSA debit card. A health savings account is the most tax advantaged of any kind of savings vehicle that Americans have, far better than even their 401ks. And yet people set a little bit of money aside in their HSA and they quickly spend it on their medical bills.
I see.
So the people that really get the most out of it aren't using HSAs for medical expenses in the first place, and those that aren't using it very effectively because they don't have the information that they need.
So, David, what's the biggest misconception people have about HSAs?
One is that it is simply there to pay your medical expenses in the first place. When you put money into an HSA, it has what's often described as a triple tax advantage. It comes out of your paycheck and therefore reduces your payroll and income taxes. It goes into an account. It can then grow tax-free, just like a 401k investment or an IRA investment.
Okay.
And then when you withdraw it for medical purposes, it comes out tax-free as well.
Oh.
Your 401k, on the other hand, is simply tax deferred. We call it a tax-free account, but it's really not. It's a tax deferred account. When the money comes out of your paycheck and goes into your 401k, it reduces your income taxes. You still actually pay payroll taxes on it, and so does your employer.
Right.
It can then grow tax-free, but when you pull it out, you pay the tax then later in retirement. So you pay the tax both on the money that went into the account, and you pay taxes on the growth that you experienced in the account. With the HSA, That's not true. When you pull money out of your HSA in retirement and use it for medical expenses, you do not pay any tax on that money. By most estimates these days, a couple that retires at age 65 and lives to be 85 or 90, which is not at all unusual today, they're going to spend $500,000 in retirement on healthcare expenses that are not covered by Medicare, right? Medicare comes with co-insurance, deductibles, just like any other health plan. So people are going to need that money in retirement. When they use it to pay for medical expenses, it's not taxed. So where you're paying 15, 20, 25% tax on the money that comes out of your 401k, that's not going to be the case with your HSA. And you never get stuck with too much money in your HSA. If you're perfectly healthy, you never have medical expenses, you can withdraw it just like it was a 401k and pay taxes like it was your 401k. That'll almost never happen because we all have medical expenses in retirement. But even if it did, you're just as well off. So if you think about it, it's kind of crazy to be setting money aside into a 401k versus putting it into your HSA. The other thing that people don't realize, when you have a medical expense, let's say you're only 30 years old, and you put money into your HSA and you have a medical expense, you can reimburse yourself for that expense anytime you want. So it can be the day of the expense, it could be a week later, it could be a year later, it could be 60 years later. When you're 90 years old, you can reimburse yourself tax-free for that expense that you had when you were 30 years old. So your access to the money is never restricted or constrained. In theory, all you need to do is keep track of what your expenses are. Maybe you throw receipts in a shoebox, maybe you take a picture of them these days, but you can reimburse yourself at any time. So you always have access to that money throughout your life. It is just the most flexible and tax advantaged of any vehicle that we have.
I'm learning something big here because this is it's amazing when you hear it. So where do people get tripped up? Or maybe better put, how should someone actually use these accounts in your day-to-day life?
My strong encouragement to people is to focus on funding that health savings account if you qualify for one, and maybe we need to come back and cover that in a couple of minutes, but fund it. Even if you live relatively paycheck to paycheck, don't feel compelled to actually pay medical expenses directly out of your HSA, typically with an HSA debit card.
Okay.
You can reimburse yourself anytime. So you ought to leave that money in the account. If you need the money 2 weeks later to pay rent, well, then you can pull it out of the account at that time. But because it's such a great savings vehicle, every effort should be made to leave money in that HSA. It should be the last money that you ever touch because it's so accessible. You can reimburse yourself for that expense anytime. And if you get the discipline and you don't need to reimburse yourself, it grows better than any other retirement vehicle we have. So when you get the best of both worlds, the maximum liquidity, which means you can tap into it anytime, and the best growth, that says fund it, try to max out as much as you can fund it, try not to use it. And so the mistake that people make is nobody explains this to them through a financial lens. Yeah. Employers simply give employees that HSA, and whether the HSA is funded by employees' payroll deductions or an employer makes a contribution to the HSA, it's irrelevant. Once the money goes into the HSA, it belongs to the employee. It never goes back to the employer. It's none of the employer's business what the employee does with that money. So the smartest thing for them to do is just let it sit in that account and grow.
Let me ask you this. You mentioned that one of the about whether you qualify or whether you can get one of those. Let's explore that part of it. Does everyone have the ability to create one of these funds? Does it have to be offered through your employer? Talk to us about that.
Sure. So the employer does not have to offer what you refer to as a qualified high deductible plan. So a qualified high deductible health plan, whether on a marketplace or through your employer, means there's a minimum deductible level that is set. That deductible in 2026, I believe, is $1,700 for an individual, $3,400 for a family. So you would have to have at least a $1,700 deductible in order to qualify to make tax-free deposits to an HSA account. So if you chose a plan with only a $500 deductible, for example, then you don't qualify for that HSA. Again, kind of crazy math. It never pays financially to choose the lower deductible plan. People do it all the time. In my own business, I see very, very well-educated medical professionals do this all the time because there's just a bad psychology at work. People feel like they're going to have significant medical expenses this year. Maybe somebody's pregnant, so they know they're going to have medical expenses, and they choose the lower deductible, the $500 or $1,000 deductible, because they want the company to pay the rest of the expenses. Well, the result of that is higher premiums.
Yeah.
And it's very, very simple math. If you choose the higher deductible plan, you're going to pay lower premiums. Just put that same money into your HSA. The lower deductible plans just about never make financial sense. Once somebody hits a deductible and then what follows, their so-called out-of-pocket maximum, a health plan pays dollar for dollar exactly the same, regardless of which plan you chose. But psychology is a dangerous thing, and people go straight to their comfort zones without really understanding the financial mechanics.
So if someone today has an HSA and they haven't paid that much attention to it, what should they be doing with it now? What's your best advice?
So these days you can move your HSA, for example, to an account where you can invest through, say, a Charles Schwab, where you have a broad range of investment options. You can treat it like any other investment account, investing in stocks, investing in mutual funds. So a lot of people let their HSA just sit in a bank account, earning very, very low interest, 0.1, 0.2, 0.3% interest, where if they had it in a proper investment vehicle, even if it was just invested in a money market at 4% today, it's going to grow.
Yeah.
But if you've got money and you're sitting on it, it's sort of like remnant 401k accounts. If you work 2 years at one company, 2 years at another, sometimes people forget about those accounts, and aggregating your money into a single account and putting it somewhere where you have the opportunity to invest it is the best place for it.
David, in our last few moments, I want to make sure I give you an opportunity to address our listeners. What should every listener out there understand about their health savings accounts before they make any next healthcare decision? I want to give you that platform to address that question.
First of all, if you're choosing between health plans, really try to understand the plans and all of the math behind them. You're going to be better off with the high deductible plan that qualifies you for an HSA. The second thing is opt into that HSA. Have it set up. Even if you only fund it with $20, $30, $50 per paycheck, start building that HSA. Get in the habit of looking at it, because it is the best investment vehicle you have. Again, triple tax advantage: tax-free in, tax-free growth, tax-free out. Recognize that when you retire, especially if you're in your 40s or 50s or early 60s and you're thinking about future retirement, don't convince yourself that, oh, thank God, once I get to retirement, age 65, I'm going to have Medicare. I'm never going to have to worry about medical expenses again. The only thing that the government really covers for you is major hospitalization, whether you're paying for Medicare Advantage plans, Medicare supplement plans, you've got coinsurance, you've got deductibles. You are going to spend money in retirement on healthcare, and that money is much, much more valuable if you're putting it into an HSA than if you're putting it into, say, an IRA or a 401k. I know a lot of three-letter acronyms. Sounds like we're
Yeah.
talking about the CIA or
Yeah,
something here.
exactly. David, I want to thank you for educating all of us about health savings accounts. This has been, I think, incredibly helpful. We just really appreciate it.
Sure. Enjoyed being here.
We've been talking to David Silverstein. He is CEO of Amaze Health,